So, good afternoon, and thank you for joining Assisting Hands Home Care, serving Mercer, Monmouth, and Ocean counties for our webinar about the mental and physical impacts of senior isolation and loneliness. Our webinars are designed to provide caregivers with information they can use to keep themselves and their loved ones happy and at home. Isolation and loneliness are significant problems in older populations, with more than 43% of seniors reporting they feel lonely on a regular basis, according to the Health Resources and Services Administration. 1 in 5 say they feel lonely or socially isolated. And this data was collected before the pandemic struck, which has made this issue infinitely worse. Addressing the issue is today's speaker, Randi Goldberg, Senior Resource Specialist at Archer Law Office. Her background in elder care includes home care, both assisted living and long-term care facilities, and representing ancillary equipment to improve the lives of seniors. If there are any concerns you'd like Randi to address or any questions that come up along the way, please drop them in the chat box and we will make sure we get those addressed for you. And I'm going to hand it over to Randi to take it away.
Hi, good afternoon. Thanks for having me. It's a wonderful format that we're able to share information these days. I believe that some of the topics that we cover have been addressed previously, but now we can actually focus on them. And I think during these uncertain times that we've been faced with, now's the time to actually chat about them. I've been in the senior healthcare world for over 15 years. As Vicki had indicated, I've worked in long-term care centers, helping provide services to the senior population. My mom is included in that. So a lot of the information is gathered with her in mind. So if you would, let me just chat a little bit about this topic. Senior isolation is nothing new. It's just during the pandemic, it has really been brought to the forefront. Actually, before the New York Times had done an expose on this, I had brought this topic up and have been discussing it for more than 5 years. It's all the uncertain times, the protocol that has been put in place has really brought this to my attention a little bit more. So right now, there are more than 11 million people and seniors 65 and older, because as the world changes, the senior population is growing leaps and bounds. So it is not just 80, 90 and above who are now considered seniors. So there are more than 11 million people who have found that isolation is something they deal with every day. It is commonplace. A lot of our seniors don't have access to a lot of resources that can keep them healthy and well cared for. As we look into things like home care services commonly are on a private pay basis, just as Vicki and Jerry provide to you. It can be done hourly and can grow into more, such as people living in your home, which previously may have not been the optimal idea, but now it is something that can be looked forward to as an added incentive. So in the isolation that we all are focusing, so again, it's not just seniors, but primarily, what do you do when there's a need to go food shopping? What do you need when it comes time to medication? What do you do when it's time to be social? Now, for example, my mother said to me once, it's very difficult for someone of her age to develop new friends. And that is completely understandable. And now more than ever, when you don't get out and you're watching TV, we'll say, and there are various different formats, whether it be TV or video or webinars, anything that you can, what happens when you're watching them all day long? Have you found that you're starting to forget things, or you don't have the ambition to get up and do things, whether it be simply to walk up and down the hallways, to get your medication, to create a meal? So when you are sitting at home 8, 9, 10 hours a day, what happens is your social ability declines. simply saying hello to someone on the phone or having the ability or desire to pick up and call a friend, that declines. What happens is when you watch, there is some content to the television shows right now, and I don't know what because I don't find them entertaining. And if you have basic cable services, I call it idiot TV at some point because your cognitive ability will not be able to absorb the content of anything that can enrich you because you're sitting at home with no stimulation. The statistics that prove that when you're at home more than 6 to 8 hours a day without any other physical or social interaction, your cognitive impairment increases each week at 1%. With that, family and friends at this time aren't being able to come over. They're in fear of bringing any kind of containment to you. So what do? Do you call your friends? Do you have a contact chain for your friends? Are they working with you? Do you have a way to, am I on mute? No? Okay. You know, contacting them. Do you have a chain to let everyone know that you're okay? Do you use that chain to let everyone know you're okay? So when you are not moving forward in having those conversations, again, your cognitive ability and your social skills will decline. If at this time you're not going out to the supermarket, how are you getting your meals? Meals are one of many things. Used to be a social event. How many times have we all said to each other, let's go out for coffee, let's have a meal together? So that's another social outlet that you're not engaging in. Are you healthy? Are you taking in all the nutrients that you truly need? And if so, how are you getting them? So are you cooking? Are you getting Meals on Wheels? Although Meals on Wheels is a wonderful service, is it nutrients that you're lacking? How are you getting your medications? Is the pharmacy delivering to you, which all of the pharmacies at this time can deliver to you? Are you utilizing that? And if so, do they leave it at your front door or do you get the chance to speak with someone who reviews your medications? So if you are not under the services such as home care services who do have an RN who can help you manage your medications, who is doing that? So as you're not getting out, more of these interventions need to be addressed. What happens is if you're not speaking with someone about your medications, whether it be your pharmacist, any other person who is helping you manage your medications, the statistics indicate that as you have cognitive decline, your medications are not being managed. That is the leading cause next to falls of hospitalizations. In addition to, if you're not going out to visit your physician on routine medical care, if you're not going out, are you making sure those medications are properly dispensed? Physician visits are extremely important because if everything is not going according to plan, how do you know whether you're feeling well? High blood pressure can be managed quite easily as long as you are maintaining everything, and then there can be supervision. Again, home care agencies can provide that supervision with the nurse or having an aide, their aide cook. You provide the food, they'll do the cooking for you. You will get nutrition at that time. You'll also have someone to engage to increase your cognitive abilities. So some of the information that I've had is there are certain target audiences that usually are isolated, whether by their own choice or not. So I also found that even when you're living with your family members, there is also senior isolation. What happens is as your family members are going off to work, school, if that applies, off to soccer or any other extracurricular activities, you're not getting the stimulation from someone of your own age group that you can chat and interact with. So there's also isolation while you're living in the family unit. Otherwise, people who are widowed, the LGBT community has a huge percentage of seniors who are isolating for many different reasons. If you're not connecting, what is your source of information? Do you get it from the TV? Do you get it from the newspaper? Do you get it? How do you get all of the important information that you need? Usually when you're at a social event, you'll gather that. So my story is I was out meeting with a professional at Panera locally, and I was waiting for her to arrive. The table next to me were two seniors who were chatting about the news. I was so happy that they could engage with each other. It was up to date. It was recent. They were appropriate questions. It was wonderful. It was outside. They were distanced and they were wearing masks. That leads me to transportation. How about those who cannot get out? At times, the senior centers were providing transportation to the senior communities just to engage in all the programs. Now that's not happening because you can't isolate on a bus. So what are you, who do you contact? How do you get out? These are huge questions that I address every day. So some of the information that I have is the key. We talked about some of the hospitalizations. So if you're not maintaining your doctor visits, some of the key reasons for hospitalizations are: one, poor medication management, falls. That is unfortunately a huge risk. There are fall risk prevention programs. There are people who can come in and review your home, do an assessment. At this time, after this, I'd like Vicki to just chat, or Jerry to chat a little bit about some of the services, because what they provide can actually alleviate some of the things. So hospitalizations are 70% higher in the senior population because you're not seeking medical attention on a routine basis. There are falls, poor medication management, poor nutrition, cognitive decline. And if you think about it, commonly what happens is seniors from the hospital, who nowadays is a revolving door because they do not want anyone staying in the hospital longer than they need to, they're then sending you out to a rehab center. So again, you're not having all the supportive services that you need in your own home. I believe at this time, getting services, whether it be home care services, assisted living, if you're appropriate for long-term care, now is the time. Why? Those are the most managed, supervised, regulated services that we have. Now, I can speak about here in New Jersey. I can speak about Florida because that's where my mom is. But they are the most regulated. They have more prevention. They have more supervision. They report to the state. If you're at home and your family is coming in, are you taking all the precautions, and do you know those precautions? When you have home care and facilities, those precautions are monitored every week, every day. The testing that they provide to all their employees.
Lori Shafrir from SBH. If you can kindly give me a call back at your convenience, 732-531-1117, extension 1.
Thanks. So everything is supervised very intently, and the state is very aware of this. So if you are looking for services, I honestly believe now is the time. What I do for a living is I help families find the care that they need in the most appropriate setting that suits them, whether it be going into an assisted living, into home care, or into long-term care services. Some of the people I've seen at this time are truly in crisis because they're waiting longer, because they have more concerns about getting outside services to come in. But at this time, they are more regulated than anyone at home, unless you have a first responder or healthcare worker living in your home. These are things that need to be addressed as our senior population ages, as the flu season is coming upon us, as everything in our world is changing and changing all the time. How can you make sure that you get everything that you need? Um, we've also found that the unfortunate is as if you're isolated and not having the proper contact information, such as police, ambulance, your decline continues every day if you're not reaching out for services. There is, when you're lonely and not having that interaction, depression is very common. And if you're not recognizing the signs of depression, then other things will lead to more unfortunate circumstances. If you're not maintaining your health now, as you decline, it'll get worse. And who are you going to reach out to? So there's lots of resources in our state. There's lots of resources in your county. A lot of people are working remotely. If you're computer savvy, looking things up on the computer, I am in many areas, such as, for example, in Bridgewater, Monmouth County, Middlesex County. The senior centers are not gathering, but there is resources available that you can always reach out to. Depending on where you live, you can go on their website. There's always information there. Your first responders will connect with you. Heaven forbid you do need your first responders. You should always have that call chain, because who's going to call who to let everyone know your communication of where you are if you're okay. There's also a program that I do in another community called Vial of Life. So a vial of life is just a vial. It's a very specific designated vial, but it has your immediate documents. So when your first responders come in, they'll address those immediate documents. Working, for example, with a home care agency, they're going to have that information as well, but having all your appropriate documents, telling everyone what you want, when you want, if you can do so. That's another level of communication. Working with your family members to let them know what you need, when you need, and how you can. And if you're not close to family and they can't come, having someone in your home a couple hours a day may be beneficial, but otherwise you can always find resources. I can go over, there's more information, some of the common diagnoses that are not being addressed, whether it be COPD, heart conditions, depression, the safety factor as we age is also a big concern. So if you're cooking and you can't smell, so you can't smell the flame, you can't smell bad food, another reason to have connections to other people too. I've covered a lot of information. It's hard to absorb it all. Meeting with people to review it is great. We can send you out a checklist of everything that you should have in place to keep you healthy and cared for. Do we have any questions just based on the information that we have at hand?
Yes, hi, Randy. Oh, I'm sorry.
Go ahead.
Oh, okay. This is Sue Brooks, and I want to thank you very much for giving us this information. I have a 92-year-old father who is still in independent living.
Mm-hmm.
But he's in a place that has independent living and all the different step downs.
Mm-hmm. He's in a CCRC.
Okay.
Which is a continuing care retirement community, which has every level of care from independent, assisted. It has subacute, which is short-term and long-term. Right. Is that right?
Absolutely. Absolutely. So in this facility, what they're basing their visitation and things are is the assisted living area, because that's what Governor Murphy has been doing. You know, if you're assisted living, if you don't have any COVID cases in 30 days, whatever.
Right.
Now, it seems like everything that's being done to keep the people engaged and active is being done with everybody except the independent living folks, which I find heartbreaking, because my father's psychologist called me to say, your father is extremely depressed. What's going on over there? They're treating him like prisoners.
So when you're in a community, you always have a point of contact. Right. Independent living is dad living in any other building. So if he were to live down the street from me, would be the same scenario as if he's living there. They can provide services, but I suggest that you definitely reach out to the administrator.
Yes.
And share that information.
Okay.
Also, dad's therapist, because this is another sign of senior isolation.
Yes.
It's depression because there is no connection, there is no physical, there is no stimulation.
Yes, absolutely.
And it is sitting there in the same four walls.
Yeah, watching TV, as you said. Could
Which
I trouble you? I'm sorry.
Sure, go ahead.
You gave a statistic and I missed it, and I really would like to get this so that when I approach them, I can cite this. You said something like your cognitive ability
declines every week. So every week there is a small cognitive decline when there is no social interaction.
Okay.
And that is, you may find just simple signs of not wanting to talk to someone when the chance occurs. It could be simple things as, oh my, where did I put my glasses?
Oh yeah.
It could be things as, you know what, I don't need to take a shower today. And if dad had commonly took a shower every day and not today, those are all simple signs. If dad dripped gravy on his shirt, that's okay.
Yes.
Those are all continual. Each day there is significant decline, and each week you will see one other small, maybe in any other day, maybe insignificant, but as it continues.
Okay. Thank you so very much for that.
Absolutely. So there should be an activity staff. There are regulations. There's definitely regulations. And this, as I said before, every community is monitored. They have to report to the state. So there is services, and that's probably why dad moved in to start with. So they can provide you with services. You need to ask what their protocol is.
Yep.
They will follow the state guidelines. You can also look up on the New Jersey State website for all of the nursing home. And all
the ombudsman.
Yep. Yeah. So there is, bringing that point, there is an ombudsman. That community is assigned by the state, a volunteer. If you find that there is misuse, abuse, complaints that they cannot address in the community, the ombudsman will come in and take a look. But you should definitely find out the protocol first. And speak with them first.
Thank you so very much. I appreciate that information.
Oh, my pleasure. My pleasure. Anybody else?
We did have a couple of questions come in.
Please.
Can you talk about what some of the signs of loneliness are? What should, family members and caregivers be on the lookout for?
Some of the signs that I just talked with Sue. So senior isolation is lack of desire. When you're at home and, for example, you know what, I'm not that hungry, I'm not going to cook. That leads to so many different things. So our bodies require nutrition to sustain themselves. If you don't have the desire to eat, that leads to, unfortunately, certain medications have to be taken with food. So maybe you're not taking your medications. And everything has a trigger, and it will lead to possible hospitalizations because those medications could be life-sustaining. So take a look at that. Lack of nutrition. Hydration is a huge topic because I find, for example, I'll tell a little story. So my mom has lived in a community in Florida for, I think it's going on 25 years. She has macular degeneration. Her hearing aids are very uncomfortable. She doesn't wear them. She plays mahjong and has with these women for years. So she finally went to the table and she kept on asking questions and speaking louder, and they isolated her and said, if you can't keep up, don't come back. So my mom went home and she isolated. She fell asleep and continually took naps. missed her medications, didn't eat, slept a lot, kept to herself. She didn't feel appropriate to be out. She didn't change, nothing. She ended up in the hospital. So follow that. There's no communication. She didn't feel that she was welcomed. So when you stay in one place, you don't move. You don't even walk around the house. You don't go outside for a walk. So even during times that we're in right now, going outside is a great option. Look at the birds, look at the sun, look at everything else. If you're not doing that, your lack of desire for those things, that is definitely signs to take a look at.
Wow, that's a really good point. How one little thing
Can snowball. Absolutely.
Snowball into a thing. So how can caregivers and seniors reduce their isolation and loneliness? Are there any tips you can offer, things they can do, particularly now?
Absolutely. Go for a walk if you can. Falls are some of the biggest reasons that seniors will go to a hospital. So be alert to if you can or if you can't. So go outside, sit on your front porch. It's a beautiful, beautiful time of year. Watch the leaves fall, look at the birds. I'm a huge people watcher. So take the time to do that. Depending on your abilities, as I had said before, reach out to your senior center. So if you are computer savvy, or if you have someone who is computer savvy that you can connect with, go on to the senior centers. I've provided programs via Zoom, like this format, to other seniors, and engaging with them. It's engagement. Get on the phone, talk to your friends, make sure that you have a contact chain of phone numbers that you can contact with. Also doing that, just checking in have a call day. So for example, I'm required, and I'm compliant. I talk to my mom every Sunday. So if you have a friend, talk to them every Tuesday. They have something to look forward to, and so will you. So there's lots of different things that you can do. My suggestion is, if you are a fan of a TV show, watch that TV show, but don't let it run on and on and on. My mom is a fan of Jeopardy. I can tell you I am not to ring that phone when she watches Jeopardy. But if that's your show, go for it. But don't sit in front of the TV from 10 o'clock in the morning to 8 o'clock at night, because then you get absorbed.
I had the same thing with my mom. Do not call at 7 o'clock at night.
Don't call during Jeopardy. Absolutely not, because she doesn't answer the phone.
And 7:30, I would get, you're interrupting Jeopardy.
Mm-hmm. Mm-hmm. Yep.
How they fall into that, rabbit hole of just the TV's on and that's it.
Well, that's it. It's a rabbit hole. So when you have lack of desire, that is one of the big signs that you're losing the connection that can sustain you. So again, it will snowball into many other things.
Yeah, and it's also very fascinating how you talked about even the folks who are lucky enough to live with families, how even though they're living with people, they can feel lonely and isolated as everybody else goes around with their life. And
absolutely. I can tell you, my girlfriend, her grandparents live with her. Most children don't recognize how lucky they are to have that, because you have a 7-year-old who's off talking about dinosaurs or something else, and the tolerance levels are different. So to have any kind of stimulation, to have any kind of cognitive improvements, you need to discuss on the same level. So talking about the cartoons, grandma and grandpa don't understand the cartoons, and the child wants to talk about them. The physical interaction, lovely, having that physical connection is wonderful, but you want to have someone who can talk the same that you talk, the same conversations, because reminiscing is a wonderful way to boost your memory.
Good point. Good point. Maybe now's the time to go through all those pictures. And
it's a wonderful thing to reminisce. Memory, when you see signs of depression, isolation, and cognitive decline, long-term care memory is more apparent than short-term care memory. So engaging in walking down memory lane is wonderful, but also make sure you recognize the signs that if it is just long-term care memory versus short-term memory. For example, what did you have for dinner?
Gotcha.
Those are signs you want to take a look at as well. Because
Okay.
right now, nothing is being recognized because people are not going to the doctors. There's telemedicine, which prevents a lot of that face-to-face. And I believe face-to-face is definitely one of the ways you can see how people stand, how people walk, how they engage. And those are all signs that relate to isolation.
Oh, so there are physical signs too.
Absolutely, absolutely. So if you think of it, if you have a bright and beautiful day, you get out of bed, as you say, you put your right foot forward and you got out on the good side of the bed and you have that spring in your step, that's because you're engaged in the day, you're positive thinking, walking outside. How many times can we all think on a beautiful, bright summer day that you're going to go for a walk? You're going to take in the sights. So if you're not doing that, you're not going to get up, you're going to shuffle, those physical signs, right? You're going to be very lethargic. That is signs to take a look at, because when you're lethargic, again, it's going to have that ripple effect, going to go downhill into, I don't feel like cooking. I don't feel like eating. I don't feel like showering. I don't feel like, and that just will continue.
All very, very good points. And as far as the resources you mentioned, are there some specific ones? Because I know on our website, it's assistinghands.com/Monmouth. There is we do have a resource section with some community connections, so people can connect with their local Office of Aging or Senior Center. If hunger's a problem, Meals on Wheels, you know, at least there's someone coming to the door.
So that's a huge resource right there. If you're going to find one center to connect with, so having everything on your website, Vicki, is huge. It's wonderful. It's one-stop shopping in the manner, because all those resources, instead of going to each different website, is a wonderful way for everyone to get resources. Making the call is the most important thing to do. So if you feel overwhelmed, you feel that looking on the website is not appropriate, make a phone call, because then you're going to get to talk to someone. That's a wonderful way to start the conversation. So, you know, you have everything right there. That's a one-stop way to recognize everybody. That's a great idea.
Yeah, and another resource that just popped in my mind that came about because I was thinking about your mom, what you said with the hearing. There are resources available for folks who are hearing impaired where they can get a telephone that translates with
absolutely.
captions. That's a simple way
My
to
mom
reduce.
has that. So there is CapTel. I actually know the people over there. So CapTel is a phone, and what happens is that there's transcription. So I have to say, the first week my mom got it, I talked a little too fast. So what happens is you call in, and actually there's someone transcribing the conversation onto a visual screen for her. So that's a way to communicate. Going to your hearing centers and getting a hearing checkup, Medicare will pay for it. They have resources in each office. Medicare itself has resources. Each state has resources. Each county, there is the Division of Aging in each county. And if anyone does know someone who you feel has met some of the signs that we're talking about, and you have concern for them, call your local police department. There's called a well check, and the police will go out and do a well check just to make sure that everything is in place. Unfortunately, I have been involved too many times to find that well check was way too delayed.
That's a really fantastic reminder, and it's a community service that the police departments offer.
Yes, absolutely.
And
then when
that's a great independent quick evaluation, because they're trained to look for certain things.
Absolutely. And so they will also make sure that they find resources for you. So if the police are called, I'm going to say 6 out of 10 times, you're going to end up going to a hospital to have an evaluation. And there are social workers who are at the facility at the hospital and resources to make that referral. Unfortunately, they're overwhelmed, and it's up to us to make sure we follow through on those referrals, but they'll give you the information.
That's great. And I know information overload can be a challenge too, because people get very nervous and scared and they don't know what to do, and they kind of, I call it turtle up. They just internalize and they can't cope.
It is. It's overwhelming when you realize that something's happening and you're not sure what, where, why, or how to overcome them. You also don't want anyone, if you do recognize it, you don't want anybody looking or seeing what's going on inside. So there's also a sense of humiliation that the senior population goes through. I did a program called How to Be a Good Neighbor. So how to be a good neighbor if you're, for example, in senior housing or in an independent living situation. Because if you know, for example, Susie comes out every week to play mahjong and Susie's not there, or if Susie comes out and her hair is a mess, instead of ridiculing people or shaming them or bullying them, it's great to be a good neighbor and say to Susie, hey, how's it going, Susie? She probably won't reach out for help, but what a wonderful neighbor you are to say, I see something, let's address it.
Yeah, that was going to be my the next question to you is, what's the first thing someone can do if they suspect their senior, whether it's someone they live with, someone they live next door to, or care about? What's the first simple thing they can do to kind of, open the door and say, hey, what's going on? What's your advice?
Literally open the door. If you have that connection, if you have that relationship, again, instead of bullying, degrading, knock on the door. Hi, Susie. How are you? I'm your neighbor. I want to just check and see that you're okay. I think that as we continue to move through neighborhoods, that good neighbor kind of rule of thumb has really gone by. I can tell you, when I moved into my first house, there was a welcome wagon. And people were knocking on your doors with fresh baked goodies and things like that. So going to your neighbor, knocking on the door, maybe giving them your phone number if you're comfortable, but checking that. And then going from there. I can tell you when I was in my home care situation, I went to see a client down in Highlands, not Atlantic Highlands, in the Highlands. And I knocked on the door, and from the moment the gentleman opened the door to the moment I left, I knew that I was doing a great service by calling the appropriate people I needed to get him services. Right? It's not a matter of, it's not a matter of what you can afford. It's a matter of how you can help.
That is a fantastic point. Does anybody have any questions? Either raise your hand or unmute yourself or put them in the chat box while we have Randi available.
Wow. So if you see anything, you know what the rule of thumb is? If you see something, say something. That's a good rule of thumb.
Absolutely.
Right.
So we'll wrap it up on that note. Be a good neighbor. And if you see something and you suspect that your senior in your life, whether it's grandma, your neighbor, your auntie, anybody, is a little lonely, reach out and say something.
Absolutely.
So thank you so much, Randi, for your time and expertise on this topic. It was a fantastic presentation. And it was recorded, so it will be available for folks to review and share with their loved ones.
Absolutely. So thank you so much for having me. And
Thank you,
thank you for
Randi.
listening, because this is something dear to my heart. It started, as I said, many years ago when my mother was, I'm going to say, a victim, and it started there. I'm always available. Vicki has my contact information. If you have any questions, don't hesitate to reach out. And thank you guys so much for having me. It was a wonderful format to share information.
Thank you for joining, everyone. Thank you, Randi, for your valuable information.
Absolutely. Have a
Thank
great
you.
day, guys.
Have a great
Bye-bye.
one. Thanks. Bye-bye.
Bye.